Good afternoon, everyone. Welcome to Ask the Expert here on Hello Dr. PH. My name is Kai Magsanok, Editor-in-Chief of Hello Doctor here in the Philippines. And with us today is neurologist Dr. Nicole Aliling. We will be talking about neuropathic pain. So, neuropathic pain 101 po to. Kasi ano ba siya? No? Kailangan ba siya seryosohin? Gaano siya kaseryoso? And paano natin madidistinguish yung neuropathic pain and other pains? Kasi di ba, kultura po ng Pinoy, napakamatiisin natin. Tapos dahil gipit, marami sa atin ng gipit ngayon, dinelay natin yung pagkonsulta sa doktor. So, we will find out today from Doc Nicole how to address, identify, and then address neuropathic pain and what are the treatments that we can avail of. Good afternoon, Doktora.
Hi, good afternoon, Kai.
So, Doctora, before we begin with our questions, why do you think it's important for us to talk about neuropathic pain?
Neuropathic pain is one of those things that from the name itself, parang you would think na, what is this? It sounds so foreign. But actually you would be surprised that it can occur in a lot of different instances from many different reasons. So there are actually people who can be already suffering from it but not aware that that's what it's called, and that there are means that they can avail so that they will have improvement on their condition.
Okay. Kasi gusto nating malaman later in the discussion, Doktora, ano yung consequences, di ba? Pag pinabayaan. No? Minsan kasi ang lalim ng threshold ng pain ng tao. That can happen.
Right.
No?
Correct.
So, okay, Doktora, for the first part of our interview, let us understand neuropathic pain. No? Understand it very well. Please define for us, what is neuropathic pain?
All right, so neuropathic pain, etymology of the word actually is revealing. So neuro referring to the nerve or the nerve cell, pathic denoting any disease or injury. So it's actually a type of pain distinct from what we usually call nociceptive, yung madalas na mararamdaman natin kapag pierce ka ng isang pain, kapag ma-stab mo yung toe mo, ganong klaseng acute pain, meaning something that you feel immediately, yun yung nociceptive pain. On the other hand, neuropathic pain, it's pain that is caused by a disruption or injury, nagkaroon ng problema doon sa nerve cell. So that's how it arises. That's the difference. And then it can also be differentiated by the characteristics. So it's very unique, but also vague in a sense. Usually, patients who suffer from it, they can have many different descriptors. Some say what feels like it's burning kind of pain, or dull, or in the vernacular, ngalay na hindi ma-describe ng maigi, or tingling, or even an electric shock kind of pain. So that's what makes it unique.
Okay. So, medyo na-touch on mo na, Doc, yung causes ng neuropathic pain, no? Pero just to be clear, so we can enumerate, kasi you said you hear damage and so on, diba? Ano yung nangyayari sa araw-araw na buhay natin? Or ano yung mga typical na accidents that we encounter that can possibly cause neuropathic pain?
For the daily activities that we do, so even just staying in the same position for a very long time. For example, especially now in this pandemic, a lot of us are working from home. So we're used to sitting in front of a desk, working on a computer, sa mga naka-work from home. Tapos, depende pa, pwedeng iba, positioning ng wrists nila, for example. Tapos, laging nagtatype. Yung pala, meron ng nagkakaroon ng compression doon sa daanan ng nerves papunta doon sa kamay. So that sometimes happens in the condition called carpal tunnel syndrome, or sometimes how we use our thumb, yung Decker vein syndrome. Those are the more common things na actually fall under the realm of neuropathic pain. Other than that, how we sit, yung posture natin. So sometimes nagkakaroon ng mga tinatawag na pinched nerve sa leeg or sa likod, which can lead to sciatica or radiculopathy. So those are the more common things that can just occur from our everyday activities, or even from hobbies, kung may mga nag-weightlifting or something na heavier than that, tapos magkaroon ng pangit na positioning na hindi naka-activate na maayos yung muscles, tapos pangit yung form, pwede ring mag-lead to a crush or a pinch of a nerve, and that can lead to neuropathic pain. But other than that, I would also like to emphasize na sobrang dami po kasing pwedeng causes tong neuropathic pain. No? So diseases, like you mentioned, because I'd like to go back to the Ask the Expert topic previously, which was diabetes. So actually, diabetes is one of the most common causes of neuropathic pain. That's also a reason. So even systemic problems can lead to pain that is manifested as neuropathic pain.
Gosh, doon pa lang sa mga nilista mong process, doktora, parang ang dami ko na
nakarelate na.
Oo, di ba? Dami ko na natik. Oh my gosh. So siguro, we can never say this enough, no? If you feel any pain po, no? Whether sure kayo kung anong cause niyan or hindi, hindi po magka-hurt, hindi po makakasakit to talk to your doctor already. No?
Right.
Andito si Doc Nicole sa interview natin para turuan tayo, pero hindi po ito diagnosis, no? Hindi po ito konsulta, no? So get in touch with your doctor po para ma-clear agad kung ano yung pain na nararamdaman. Kasi ang iniiwasan natin, di ba, doktora, na yung quality of life or even our livelihood, no, maapektuhan na because of pain.
Yes, for sure. Because you won't be able to function as well if you're pain-free compared to if you're living with something na, sige, natitiis ko pa naman, so hindi ko na muna papatingin ito. But later on, biglang mapapansin mo, pangit na mood mo, pangit na yung functionality mo sa trabaho. So, nakakaano rin siya, nakakabawa siya sa productivity ng tao kapag pangit yung quality of life.
Yeah. Kasi nakakamiss. Sometimes I think back, I'm in my 40s. I think back to when there was no pain. Yung life before back pain. I miss
in the teens or 20s pa.
Yeah, di ba, Doc? So, yeah, nga. So, okay. So, na-touch mo na, doktora, yung manifestations of neuropathic pain. And is there any clear-cut way of identifying that the pain is neuropathic or is it something else? Kasi ang madalas namin natatanggap dito, for example, ang takot kasi ng tao is cancer. No? So, lagi nilang tanong, how do I distinguish between pain, and pain that is a symptom of cancer already? Is there a way, or is the only way really to see a doctor and undergo screening tests?
Although, of course, the safest way would be the latter, seeing a doctor and making sure, because everything nowadays we can search up online and it can lead us to many different scenarios, and sometimes it's more scary that way because you think of all the other possibilities. But if you have somebody who's familiar, who's seen people with your condition, or at least not even an expert but is familiar with the things and how they present, then they can tailor down just by talking to you, actually. So the best tool that we have to diagnose neuropathic pain is a clinical evaluation, meaning how we get the information from you, from our interview with you, how we see you during our examination, your physical examination. So we can check, okay, this really sounds like it's probably due to this, or okay, maybe we have to evaluate and to what we say, rule out other more difficult or dangerous diagnoses. So that's how we can do it. But maybe as a differentiating factor would be if how long you've been living with it, or how long you've been affected by it. So sometimes if it's something short-lived, then probably we don't have to worry about it, especially if it's just improving on its own. But sometimes when it's something that persists or even worsens, so those are the kinds of symptoms that we have to really focus on, because they can be harbingers of something that is more treacherous, so to speak.
Yeah, because a lot of diseases mimic or mask themselves ng ibang conditions that are more familiar to us. Pero yeah, the best way talaga is to see your doctor.
And interesting that you mentioned cancer, because cancer in itself, as the disease, or even treatments that are targeted for people with cancer, are also one of the causes for neuropathic pain. So yes, they can be an indication of the other.
Okay. So let's kind of differentiate, Doktora, yung iba-ibang levels ng neuropathic pain, no? Parang ano pa yung functions na meron pag the neuropathic pain is just mild compared to when it is moderate, and then when it is severe. Parang ano pa yung functions na meron and ano yung nawawala as it progresses to severity.
All right. I was trying to see if there was something that really would make it clear-cut if we can divide it or classify them into mild, moderate, severe. Maybe one would be in terms of how long you've had it. Have you had it for a shorter period of time, or it's something that you've had to live it for such a longer time? Because obviously, the longer you've had it, the more debilitating it's going to be, and the more that it will affect not only your perception of the pain, but that just living with pain will actually color how you look at your entire life, actually. Some will call it catastrophizing. Yung parang ramdam mo na wala na, hindi na ako, my life is no longer worth living because of the severe pain that I have. Down to the point of course, we're more aware now of mental health and its importance, right? So it's really linked to other diseases, mental illnesses such as depression and anxiety, and those are very real and very dangerous comorbidities, I would say, of neuropathic pain that has been around for such a long time. So maybe that's one that to differentiate, and another would be the areas that are affected. Is it just limited to, for example, like I mentioned, carpal tunnel, right? So it's usually limited to your fingers or your wrist for the curve vein. So maybe if it's affecting a smaller part, it's going to be more manageable to live with. But others would also argue, but I'm using my right hand for everything, so that's also very debilitating for me. Then that's probably not just mild. So it's not very clear cut compared to other illnesses na talagang may mild, moderate, severe tayo, because it will depend on how that person perceives the pain that he or she has. But probably one sort of example of a very severe pain that others will have is some people who would have had, for example, so cancer pain, like you were talking about. So that can affect many parts of the body or even the entire body. So that would be very, very debilitating. And that would be one example of a severe type. Or even people who have, okay, so I'm just listing down, enumerating different examples, no? People who have had to have a limb amputated. And then some people, even after having that limb removed, they have what is called a phantom limb phenomenon. So that's another example of neuropathic pain that's very unique, because you're already not chopped off, but you already amputated that limb, but that person still feels that they have a limb. And not only that the limb is painful. The limb that is no longer present is painful. So that can be very debilitating on so many levels.
Yeah, tama ka, Doktora. The severity is relative then, I guess, to the livelihood, no? Pag hindi na, like, I used to be a fashion stylist, but one day I couldn't move because of the pain on my back.
Right.
I thought it was kidney, so I went to a nephrologist, and then after asking for my symptoms, he said, I have a suspicion that those are slip discs. And that changed my life because I had to stop that line of work. No? So
I see.
Yeah.
It affected your career even, right?
Everything. Yeah, my entire life. Which then affected me as a parent, the quality of life I was able to give my son. So yeah. Okay. Why is there a need, Doc Nicole, to diagnose neuropathic pain correctly?
Because usually the earlier we can diagnose something, and if we give it a right label or the right diagnosis, the better we'll be able to treat it. As it goes, I guess, with any kind of condition, the earlier that you're able to nip it in the bud, so to speak, then it's going to have a better prognosis. Because some people actually maybe like something close to what you've experienced. So thinking first that it's a kidney problem, then you're going to see somebody who treats kidney problems first, and then not realizing, okay, but I still have this pain. So I had my kidney checked, but it's still here, right? So and also obviously that will incur costs, because here in the Philippines, all of our treatments are mostly out of pocket unless you're indigent and you're able to apply for subsidy, right? So also down the line, that's why actually neuropathic pain, if you look it up, it's one of those things that actually, if you compile all of the costs that each person will go through, from the initial manifestation down to seeing all of the different practitioners and then specialists and then all of the treatments before something works, or even if something doesn't work, then they still have to live with the pain. So it can become very costly in the long run. So for the proper diagnosis, immediate and proper diagnosis for a better prognosis, and to be more cost effective.
Earlier, we catch neuropathic pain, di ba? Parang hopefully the less cost it will incur, not just
Right.
the person's pocket, but their entire life. No?
And hopefully, if we catch something that's actually reversible or treatable, then they don't have to live with it for such a long time, compared to people who weren't able to see it or recognize it immediately.
That's a game changer. So neuropathic pain is reversible.
Some causes may be reversible, some causes, however, may not be.
Okay. And to determine these, what are the tests, Doctora, that usually patients have to do?
Right. So again, I will emphasize that it's usually a clinical diagnosis. So actually, there are a lot of rated or what do you call this, questionnaires that practitioners can use, so that we can more or less iron out if it's really neuropathic pain or is it something else, and that's usually sufficient. But just to be sure, or just to sometimes delineate where the cause of the neuropathic pain is, or where it arises from. Is it from the nerve, as in like the peripheral nerves on the limbs, or is it from a problem in our brain or in our spine? So that's sometimes where we can delineate them, and that will entail us using either electrophysiology. I don't know if people will be aware of electrodiagnostic medicine, so that's one of the things that we can use, or imaging of the brain or spinal cord as warranted. So you don't have to go through everything. It's the practitioner who sees you who will actually limit the things that you have to go through also. So that's why it's also good that you get seen by a doctor, because you don't have to go through this whole gamut of diagnostics and expenses. So they can just tailor it to what's specific to your needs.
Doktora, pag-usapan natin yung rin ng Pinoy to self-medicate. Sisa doon na tayo sa sa diagnosis, no? And we are advising everyone, wag po kayong mag-self-diagnose. Tama lang po magpasa ng medically verified articles. Pero kausapin po ninyo yung doktor ninyo. Yung pangalawang tendency, favorite ng mga Pinoy gawin, is to self-medicate. And di ba, Doktora, alam natin, madami namang over-the-counter na pain meds. Diba?
Yes.
I want us to very clearly parang spell out, diba? What is the danger? And honestly, this fascinates me about, American, yung Western series and dramas, yung pain medicine addiction. Diba? So, ano ang pwedeng maging harm? Is it advisable? That's my first one. Is it advisable to self-medicate, and go over the counter, consult a pharmacist for your pain? Or is it better to, what's the difference between prescription pain meds? Diba? Yung talagang targeted towards maybe once identified by the doctor, the specific neuropathic pain.
Right. So, to answer the first question, is it advisable to self-medicate? And of course, from my line of work, I will say no, because, usually it won't work. especially when we're talking about neuropathic pain, your usual over-the-counter medications that you get for a simple headache or a simple is very, belittling things, but from a simple muscle ache or pain, as those from that what you would need for your neuropathic pain, they're vastly different. So, and even among those with diagnosed neuropathic pain, sometimes they have to go through different kinds or classes of medications before they find one that suits them. So it won't work. It might not work. It might be more costly that way if you just try to do it yourself. And I have a lot of patients who come to me also that tell me, Doktora, ito po sinubukan ko kasi yung kakilala ko, yung kapatid ko, yung kapitbahay ko.
Yes.
Meron din po daw sila nung nararamdaman ko. Tapos ito po yung parang, ito po yung iniinom nila. And of course, we treat patients as individuals, and what works for one person doesn't necessarily work for the other. So that's why we have to make sure that you see somebody who will examine you as one whole person, and also taking into account the different factors that will benefit you compared to your kapatid or your kakilala. And the other one is, addiction. But thankfully, I'm not very familiar with the numbers, but I think in the Philippines, it's not as common because it's harder to get access to medications that can build your tolerance or dependence. But yes, it does happen. So it's also another thing that we have to be wary of, because sometimes when you're not treating it to the right dose or to the right kind of medication, and then you keep on testing these other things or just topping up your dose of something that was not even correctly prescribed to you, then you can actually build what we call tolerance. So what your usual dose doesn't even work for you anymore, so you have to keep on taking a larger and larger amount until to the point that you can't function without that drug in your system. So that's also another danger of self-medicating.
Of course, diba? That might affect the liver, that might affect the kidneys. Ako, Doc Nicole, hindi lang yung sharing ko anong tinitake. Minsan nagbibigayan pa.
Yes, oo. Sila pa yung nagdi-dispense mismo. Sobrang pagbigay. Generous din ng mga Pinoy.
Diba? Pero yun nga po yung siguro part po ng Filipino culture natin na kailangan natin baguhin, no? Pagdating talaga sa gamot, makinig sa ating doktor. Diba? Okay. So let's go quickly to preventing neuropathic pain, Doktora, or preventing it from getting worse. So for those who do not suffer from neuropathic pain yet, the blessed ones.
Yes.
What should we do? What should we do now in order to prevent neuropathic pain from happening?
So a lot of things that is applicable to having a healthy lifestyle in general will also help us from preventing the onset of neuropathic pain. Regular exercise, of course, with not overdoing it also, because sometimes people who are at work Monday to Friday and then Saturday, Sunday, they're free to do activities, and then they forget na wait, hindi pala conditioned yung body ko, not like before that I can keep on doing this. So that's sometimes when you get injuries, that's the usual scenario for us to get also people who get the repetitive injury that will lead to neuropathic pain. So, but a healthy lifestyle within what is actually recommended is 150 minutes. This is for most healthy adults. 150 minutes of exercise throughout the week. That is enough to raise your heart rate or measurably to a point na hinihingal ka or it's hard for you to speak. So that would be enough already. So that would be 30 to 45 minutes every other day or most days of the week. So as long as you keep to that, you also keep decrease your chances of getting lifestyle diseases such as cardiovascular diseases, including stroke. And that's important because having stroke, for example, can also lead to a neuropathic pain condition. So one begets the other. So anything that will prevent you from having those injuries or your kinds of what we call preventable, non-communicable diseases. Also, of course, healthy lifestyle will include no smoking at all, because smoking prevents injury and builds up your radical free radical formation in the body, so that is toxin formation. And if you have already some injury to your nerves, that will make it harder for it to regenerate or to heal. And also just a moderate amount of alcohol. I'm not saying that no alcohol at all for people who are drinking, but if you keep it to 1 to 2 drinks per day and not binge drinking, yung mga nag 1 to 2, di nila, na-skip ko naman yung 1 drink ko today, doktora, baka pwede kong i-accumulate dun sa Sabado yung 5 drinks ko na na-skip ko. So no, because your liver, your body can only clear so much at a time. So that's also a reason why, because, and I know this is a hot topic when it comes to nerve damage, alcoholism, chronic alcoholism also brings down our reserves of vitamin B in the body, and that also can lead to neuropathic pain. So that's why it's also important. And then lastly, if there are already, you don't have it yet, but you're starting to feel that, okay, there are certain movements, postures that are making me uncomfortable and might lead to neuropathic pain later on, and definitely try to modify that activity. So if you're sitting down a lot because of work, then every hour just try to stretch your legs, move about a bit, even for just a couple of minutes, and then sit back down, and that will already work wonders for the load that your back and your spine has been experiencing for the entire day.
Right. It reminds me of what Dr. Ayi Fanier, the endocrinologist we interviewed one time. Sabi nga niya, sitting is the new smoking. But my takeaway from what you just shared, Doc Nicole, is sitting and smoking are both bad. No, I mean,
right,
lifestyle. You're right. Again, we go back to yung basics na natutunan natin when we were kids, no? Yung balance, go, grow, and glow. Activities, di ba? Eating a rainbow, yung ng Pinoy.
Definitely. Yes.
You mentioned vitamin B deficiency as a possible result of smoking, no? Yung tama
of chronic alcoholism.
Sorry. So supplementation. No? Some people think na will vitamin B, taking vitamin B now, or multivitamins with vitamin B, will that prevent neuropathic pain from developing? Provided hindi namin sundin yung ibang advice mo about lifestyle, exercise, di ba? Kasi gano'n naman yung isa pa ko galing Pinoy. May gamot na kami. Meron na bang supplement di ba? May pang-balance ako, gano'n. Will that be enough? And if you do take those supplements, will they at least help lessen the chances of neuropathic pain or for neuropathic pain to worsen compared to someone who is not taking any supplementation, for example?
Right. So unfortunately, no. Not because we will supplement it will mean that we'll be able to keep neuropathic pain at bay. If only because there are many different routes kumbaga to get there, right? So vitamin B deficiency is just one, and it's also more seen, it can be an endocrine problem also, or an inborn error of metabolism in some people. So they really have very, very low vitamin B stores, and those are the people who really need vitamin B supplementation because they either don't have enough, cannot produce enough in the body. So those are the only people that I would say they really need their vitamin B supplementation. Otherwise, like how you mentioned it, that was very well placed, very well said. If you eat a rainbow, so meaning you just try to get as much variety into your diet and keep it balanced to go, grow, and glow, for sure, it's so easy to get vitamin B everywhere, especially for us Filipinos who eat a lot of rice. So usually, it's one of the good sources. Whole grains are good sources for vitamin B, as well as other legumes and other food sources. So it's better to eat whole foods, to eat them, to get your nutrients from the food that you eat, compared to just giving them in supplements, because it's not just the vitamin in itself. Sometimes it's the excipient, or if it comes together with the other ingredients that make up one food that makes it more available to our body. So that's why it's more advisable to do that. And then yun din, yung parang a pill for every ill na na attitude, 'di ba, na mas mahirap yung sinasabi ng doktora na kailangan ko weight reduction para hindi na masakit sa spine ko, para hindi na bibigatan, para di ako nagkakaroon ng sakit. Mas mahirap yung sinasabi na kailangan ko pa kumain ng mas madali naman na magpa-order in na lang. Although I would argue na even people who are strapped for time in preparing food, there are a lot of ways to make sure that the intake that you get is still very nutritious. No? Tapos yun, so parang gamot na lang or supplement na lang. But yeah, something that I also try to inform all of my patients that the foundation for all of our treatments that will actually make your body more receptive to the treatments that will give you is having a healthy lifestyle. So yun po talaga yung foundation ng lahat. Kasi kahit na bibigyan ka ng gamot, pampababa ng cholesterol, pero in the end, kakain ka pa rin naman ng maraming cholesterol. Parang kina-counteract lang natin.
Yeah.
That's not going to benefit you very well.
Actually, kinalakihan ko yan sa father ko. My dad passed away to a stroke as a complication of diabetes. Okay.
No, I'm sorry
I
to
always
hear that.
heard, my dad, as I was growing up, a brand of medicine that's very popular, a statin. And he would always say, di ba, meron naman ako nito eh. Alam mo yun, as a kid growing up, you see your parent say that. So, that kind of taught me to make different choices. So, grateful pa rin ako sa father ko. I learned to make better choices. But he taught me by example, what not to do. Thank you, Dad. He's in heaven. So going back to that, let's go to the myths and yung myths surrounding neuropathic pain. So first myth, it is only caused by vitamin B deficiency and therefore taking vitamin B supplements will address or cure it.
Yon, so we tackle that. So it is a myth because it's not. There are myriad of sources, about as many as there are sources of injuries to our nervous system, the ones that we treat as neurologists. So it comes from many, many different sources. Kapag may stroke ka naman, hindi naman necessarily vitamin B yung sagot doon. Kapag may multiple sclerosis ka kasi, hindi talaga vitamin B lang ang sagot doon. Or yung mga nagte-trigeminal neuralgia, na sumasakit yung mukha kahit anong mangyari. So ang dami talagang especially yung mga from repetitive or exercise injuries, then that's definitely, I'm not ruling out the role of vitamin B as a supportive in those conditions, but it's not the end all be all, definitely.
Okay, thank you, Dr. Second, myth pa to parang ganito. Titiisin ko ang sakit, baka sakaling mawala pa. Yung ng Pinay na, mawawala din yan. Diba? Tiisin mo na lang, mawawala din yan.
Oo.
Laban lang. Di ba yung mga parang, yun yung, I guess, ako never ko talaga naintindihan what it means to be yung toxic positivity. You know what I mean? Feeling ko parang, may mga cases din kasi na parang, hindi kasi kailangan na ng pahinga. Alam mo yun? Or kailangan na talaga ang tulog. Hindi yun. Laban lang, trabaho kahit stress na ako.
Oo.
Okay.
Talagang there's only so much we can do with a positive mindset. Sometimes we have to get real also with ourselves. Okay, we have to stop. This is really too much. And if we ignore it, it's just going to get worse. With most pain conditions, even kasi nabanggit natin kanina na yung headaches, migraine, being a migrainer myself, the earlier you can nip it in the bud, mawala na siya, nag-aura ka pa lang or mas okay na agad yan. So same with neuropathic pain, the earlier you recognize it, yun nga, baka pwede pa pala siyang ma-reverse, baka pwedeng hindi na siya mag-progress, no? Or kung nandyan na talaga siya to stay, baka mayroon na tayong natutunan sana na better ways to live with it, na hindi yung tiniis-tiis lang natin. Tapos, mas masaya pala sana tayo, even if we live with the pain, but we learn to make the pain our friend, something like that. So, meron sana talagang magagawa kung mas maaga natin siyang masolusyonan.
Yeah. Ayoko yata maging best friend ng pain, Doktora.
Or parang that acquaintance who's just always there, but at least you don't hate it anymore.
Yeah, pero don't let it come closer. Diba?
Yes, exactly.
Okay, yung third na myth, Doktora, well, this might be true, no? Mahal gamutin ang ganitong sakit. I think sometimes what stops people from seeing a doctor in the first place is they
Right.
think na, natin, gastos lang yan. Pag may nakita pa yung doktor, dadami lang yung gastos, no? Pero how do we address this kind of mentality? Kasi nga, di ba, we know the consequence.
Correct. Yun nga yung problema minsan, no? Parang masisi pa kami. Happily, blissfully ignorant na sila before. Parang dati naman wala akong sakit. Nung nakita ko yung doktor, dami ng sakit. Kasi nalaman na, na-diagnose na po natin kung ano yung mga sakit nyo. So yun po minsan yung nangyayari. And it's not true. Although, ayun nga po yung mahirap sa healthcare system na lahat kasi ng kailangan mo, ilalabas mo out of pocket. So yun yung ano talaga reality that, well, the medications, they will cost you something, and then doing the tests, they will cost you something. Even seeing the doctor will cost you something. So, in a way, yes, meron talaga siyang cost. But can you imagine comparing that with the cost of living with something na sana nung una pa lang pala, nakita natin, hindi pa siya masyadong problematic. De sana, umpisa pa lang, nauntian na natin yung yung kailangan na igugol na not just resources and cost, but time and effort. Right. Because wala naman atang condition na mas madaling gamutin kapag later on na siya, 'di ba? Kapag mas marami ng komplikasyon at mga kasabay na mga bagay, it's going to be really more difficult. Prevention nga is the best. So even when if you're not sure but you want to, like how we talked about prevention earlier, so even seeing a doctor for something that you might think na, is this going to be a possible problem for me because this runs in our family, we think, or is something, then even earlier on, before you even feel anything, then you can already be advised what to look out for, what should you be monitoring, diba? The things that you have to do also kapag mga parang annual physical exam, or kung ano ba yung mga nare-recommend sa mga tao, because cancer is always very hot topic naman yun. O at this age, ano ba yung dapat chine-check para hindi na natin kasi yung mommy ko, yung tita ko, merong ganito. Ano ba yung dapat gawin ko? So even those kinds of things, it's actually better to consult your doctor before you feel anything, para lang to make sure na it stays that way. Instead of later on, just tiis-tiis na lang natin kasi nagtitipid pa ako. It's not going to be cheaper later on.
Agree with you, Doktora. Anyway, para sa mga viewers natin or readers na hindi alam paano humingi rin ng tulong sa ating government, no? We're preparing a series of articles to teach us how to approach the government for health care support. Okay, that's always an option. Yes, Doktora. Yes. Kasi nga, we had our Facebook Live on breast cancer and we were overwhelmed with all the queries, and a lot of women, Filipino women, are manifesting symptoms already but not seeing doctors because of the financial constraints. No?
Yeah.
You have a case study, Doktora, of, for example, a patient na na-reverse pa ninyo yung neuropathic pain. Can you share with us a success story? That's a
success story. Can I make it myself? Kasi yun I mentioned earlier, I also suffered from carpal tunnel syndrome and decurvins. Carpal tunnel because of just repetitive activities, typing or even riding a bike for a longer period of time and not being able to change the position of my hands. Thankfully, my husband actually kasi is an orthopedic surgeon, so he was able to also help manage me with it. So, splinting, that was that's the pinakamura na pwedeng gawin. Just immobilize it so you don't further injure that nerve. Yun yung mag-splint ka. Tapos modify, and by splinting you will also modify the activities on how you do it, so it's a matter of positioning also, and trying to avoid those positions that will aggravate the pain. So thankfully I forget how long it was, but in a matter of months it was quite better. this one, the other thing that I experienced was after, ito nakasympathize ako after I got pregnant and gave birth, yung having Decker vein syndrome. So yun naman, because we talked about injuries and other conditions that can cause neuropathic pain. So that one is actually, well, getting pregnant and giving birth is neither of those things. It's physiologic. Pero because of the hormones and the additional carrying a baby around, so that can also cause the mga awkward positioning. So that nagkaroon ako ng sympathy, ng empathy tuloy sa mga dahil na-experience ko na siya. So also immobilization and then rehab exercises, mga slowly returning to injury because I was also coming from a state of having a physically active lifestyle and then having to slow down a bit and then slowly getting back to becoming more active after that my wrist felt better. So those are two examples that maybe some people can relate to that are actually not easy, but I would say there's really a lot of means that we can give them that wasn't even expensive, right? Parang magsisplint ka lang or maggagawa ka lang ng konting exercise program mo. I didn't even have to take anything for it to get better. So hopefully that inspires other people na there are also ways, especially if you're able to diagnose it or recognize it earlier on, then it can be reversed. It can actually be helped.
Okay, so that leads me to my final question, Doctor. Your message to our viewers who are watching, either they're already sure, that they have neuropathic pain or they are not sure, diba? Ano ang yung advice? Ano ang yung payo? What should they do right after they watch this interview to address that?
Right. So, and in the spirit of Hello Doctor, di ba, parang knowledge is power, and knowing what you have or what you may have and how you can possibly be helped, it's the first step. And recognizing that you need help is actually very important for you. And try to seek out also help from verified sources, and of course targeted help from your individual consultation from your doctor. And just make sure that if there's any takeaway sana from this, it's that a healthy lifestyle will work for everything. So just make sure to avoid smoking and eat a very healthy, balanced diet. Try to make sure that you have physical activity as much as possible. And then barring those things, if there's any limitations to those, or if there's anything else that you think really needs more appropriate care, then please do consult your doctor.